Welcome back to Revolt Black News. Now, despite the recent news that the FDA has finally approved the Pfizer COVID vaccine, there's still a bit of hesitancy from our community, and in particular, it seems, from some Black men. So we thought we'd bring in some excellent Black male physicians to help examine both the fears and the facts. Joining us is vascular cardiologist, professor, and friend of the show, Dr. Bernard Ashby. Also with us is a psychiatrist who specializes in forensics, integrative health, and psychotherapy, Dr. Thomas Oden. Welcome both of you gentlemen to the show.
Thank you.
Thank you. Thank you very much.
Of course, absolutely. Now, we know that when it comes to unvaccinated Black men in America, they seem to have a particular age range. I'm interested to hear from both of you what you've experienced in your conversations with patients and otherwise. What other commonalities do unvaccinated Black men seem to share? I'll start with you, Dr. Ashby.
What we see is that, in general, African Americans across the board have a much lower vaccination rate than the general population, particularly when compared to whites. But there's also a gender gap that transcends race, but is more apparent when it comes to African Americans. And so it's hard to get the granular statistics on this, but the range goes from 10% to 100% gap between women and men when it comes to vaccination rates. And there's a number of reasons, and one of the things that we see now in social media is that there's a ton of misinformation and a particular proclivity to folks engaging in conspiracy theories. Now, I do agree that we should not trust the government. They have not earned our trust. And particularly in healthcare institutions, we see how people of color, particularly Black women and Black men, are treated. There's a real issue there. And so you can't just come out the blue and say, take a vaccine without actually proving that you care about us, because their actions thus far have indicated the opposite, meaning that they don't attend to our healthcare needs. And the fact that they are pushing the vaccines without any comprehensive strategy kind of, calls them for what it is. All they care about is getting vaccines in arms. And I think we have to understand that part of the equation to really connect with folks, because, the vaccines are safe, they're effective, but the CDC, the FDA, the healthcare institutions have a long way to regaining our trust. But I don't think they've ever had it, to be honest.
Indeed. Dr. Oden, to that point of connecting with people, you recently did a really powerful and important Instagram Live to discuss these very things as it relates to the vaccine. Again, did you notice any commonalities amongst some of the Black men in particular that might be hesitant around the vaccine?
Right. I've seen commonality in regards to many Black men are seeing themselves understanding what's happened in history. So many of them knowledgeable what's happened in the past. Many of them are distrustful of the government. They feel like the messaging has been mixed. We always see this pattern in government where years later documents get declassified. We see things that have been done to us, and that's been hundreds of years in the making. I see many people that want to have their own body autonomy, that are trying to break a lot of barriers, and they want their independence and don't want to fall into any patterns or statistics. They don't want to be experimented on. And so when you have those concerns, when you go on social media, most people go online and they actually find things to confirm their fears. They don't really go and look up things that may actually be contradictory to what they believe. And so when you have general distrust that was hundreds of years in the making, when you're trying to do the best that you know how to do to take care of yourself due to health inequities that exist in our country, I think that leads to a recipe of distrust. And when you try to educate yourself and make the best decision possible, due to disinformation, misinformation, it's very easy for you to get lost in the clouds of so many different people trying to tell you what's right and what's wrong.
That makes sense to me. Dr. Oden, you and Dr. Ashby have both referenced the historical breach of trust, to put it mildly, of the United States government. A lot of people around their vaccination hesitancy cite the Tuskegee Experiment. Lots of misinformation on social media about what happened there, what didn't happen there. Dr. Oden, just clear it up for us. What exactly happened to Black people and Black men during the Tuskegee Experiment?
Sure. It was a 40-year experiment to see the long-term effects of untreated syphilis. That was years in the making of scientific racism. They believed in Darwinism, that we were less intelligent, that if we were actually sick, we wouldn't get treatment. And so that's what they were used to justify this government funded study. And so what I'm finding myself having conversations about within many people in the community that are, pro-Black, we want to make sure we're taking care of ourselves, is that I know you don't want to be experimented on. You want the opportunity to take care of yourself. You don't want to be part of any type of science project. But the reality is our demographic, our age range, our socioeconomic standpoint, Black people live in the same areas. And so technically not being vaccinated subjects you to more severe disease. It puts you at risk of more severe disease. And so basically our deaths, our suffering is going to be used to understand the coronavirus a lot more from us not being treated. And so actually being afraid of being experimented on or being used for research, actually not being vaccinated is the fastest course to that action taking place.
That's a great way to put it right there at the end, Dr. Oden. Not being vaccinated is really the fastest course of action of duplicating the trauma and tragedy of the Tuskegee Experiment. I think that's very clear. Okay, so this is an incredibly important, nuanced, specific conversation that we're having, and this is what our people deserve. But sadly, we know that there are those interests who would try to hijack this conversation right now for their own bias. We know, like the example of the Lieutenant Governor of Texas, who right now is trying to blame Black America for being the biggest group of unvaccinated Americans. Now, right now, Black Americans only make up 13% of the populace, and the Kaiser Family Foundation has found that it is white adults who make up the largest unvaccinated population. So just for clarity, clearing up these false narratives, Dr. Oden, can you set the record straight on this?
Right. I feel like false narratives have carried within our community for such a long time. There's always trying to place the blame on us for different things going on in the country, although we don't create the policies that really have great influence on our country. But yes, we know the data is showing that white Americans are really the largest group that's really responsible for the spread of this virus, and that's been going on for quite some time. But I am seeing more people get vaccinated in our race group. I am seeing us get more awareness. It's just taking time, and unfortunately, this virus continues to shift and spread. So there's just more opportunities like this to talk on these platforms in order for us to really send the message forward.
None of this undoes the horrific inequities of health disparaging natures that happen to our people in this country, but this opportunity to assess our natural immunity and get vaccinated would certainly improve upon our current station as it relates to this pandemic and future pandemics. Dr. Ashby.
My take home point is that like the reason why we're here, the reason why Black physicians are here, we're not supposed to be like white physicians. Like we're supposed to carry the distrust and carry the interests of our community and verify everything before we go back and tell our people to do anything. And that's kind of what I'm saying here is that I've looked at the original data, and this is what I'm recommending, contrary to what the CDC tells you. And I got receipts and information to back it up.
Copy that. Dr. Oden, final thoughts?
Yeah, so this pandemic is becoming the disease of the unvaccinated. We know that vaccines work very well. We've gone through a lot as a people, so it's very understandable and actually logical to be distrustful of this vaccine and other vaccines that are available. And well, the government hasn't cared about us for so long. Why do they care about our health and well-being now? That makes complete sense. Anxiety, worry about what can happen. Oftentimes, anxiety can distort your thinking. It can make you not see the bigger picture. And then when you go online and search things, you're going to find things that likely confirm what you're reading. And that's just due to algorithms and things like that. So it's very important to discern. There's so many things are going on right now in the pandemic. Understand that Black physicians are charged, and we understand that it's important for us to help our communities. Most of us went to historically Black medical schools, and so we knew that we would have to educate our people, that we would have to work in underserved communities. We understood that very well. And so as much as there's so much distortion, so many facts getting misconstrued, understand that we are here to help, understand that you look like my family members, so I'm not going to do anything to harm you. There's questions, and that makes a lot of sense, but just go through the proper channels, talk to physicians if you have the opportunity to, and just make sure that you're making the best decision possible. But the vaccines actually work. I know a lot of people are going to likely not get vaccinated due to their anxiety, and it's going to cause them problems when they actually get SARS-CoV-2 that develops into COVID. And so discern the proper information, understand Black doctors are here for you, and we know that there's more work to do, and we're going to do what we can.
Dr. Oden, Dr. Ashby, gentlemen, I can't thank you enough. That's why you're here today on Revolt Black News. We understand that we all have a shared interest in saving lives, saving Black lives, and saving the lives of Black men in this conversation in particular. We felt it was important for two Black, brilliant male minds to speak on it, and you've done that. We thank you so much. Appreciate you.
Thank you. Thanks for having me.
Hey, y'all. Now, for full episodes of Revolt Black News, tune into Revolt TV. And if your cable provider doesn't carry it, make sure you reach out and let them know that you're trying to join the revolution. I'll see y'all every Thursday night at 9 p.m. Eastern, only on Revolt.